constantly living and working in the fear that we're going to run out of stuff.
Medical staff in New York say they're dealing with a COVID-19 emergency as the state accounts for about half of the cases in the U.S. At a COVID-only hospital in Brooklyn, those on the front line say hospital beds and equipment may soon run scarce. And can we here in Canada be facing the same growing problem?
We are running low on those ventilators, so we are really eager to get more supplies because it's really, really stressful to constantly work on the edge.
Julian Kavanagh is the chief resident physician in neurology at the SUNY Downstate Medical Center. He's originally from France and has been in the U.S. for 7 years, where he says all hands are on deck in treating just over 500 COVID-19 patients, with 200 that are intubated.
Oncologists, dermatologists, pathologists, everybody is helping out the emergency room, the internal medicine floors, the ICUs, to help them cope.
New York State is the epicenter of the pandemic in the U.S., just over an hour away by plane from Montreal, and many Canadians traveling there regularly, like members of the Hasidic Jewish community in Boisbriand, Quebec, some coming back from Purim celebrations there, having contracted COVID-19, forcing a lockdown of the community.
New Yorkers are kind of on top of each other. So epidemiologists will tell us later what was the actual transmission rate of SARS-CoV-2, but I wouldn't be too surprised if it was higher than other places in the world.
He anticipates this will result in an elevated number of deaths from the virus.
Last week, we rented a refrigerated 18-wheeler truck in anticipation of having all these bodies piling up at the morgue.
And facing a short supply of key COVID-19 medical supplies. Also being felt here in Canada, the premiers of Quebec and Ontario warned of running out of medical supplies very soon.
We need beds, IV pumps, but also personal protective equipment. The mask like this one's, but also the N95 mask were more protective.
The barriers that ultimately keep healthcare workers protected from COVID-19.
More than being afraid of the virus, I'm sometimes afraid of myself and making the mistake that would consist of touching my face at the wrong moment and infecting myself.
He says the stress is outweighed by the work they're doing to treat people and has a message for Canadians watching.
Follow the instructions and step up to the moment. This is your historical chance of controlling this epidemic.
In Montreal, Alicia Rubertucci, City News.